With a surge in respiratory viruses this flu season, there is also concern that the hospital situation could get worse, and that may mean revisiting some pandemic restrictions, including mask mandates. Joining me now is Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. Dr. Moore, good morning. So glad you could be with us. So let's get straight to it. You raised a lot of eyebrows yesterday when you suggested that mask mandates may return. What indicators are you watching?
Well, morning, Marcia. I absolutely hope we don't have to get there. There are still actions that Canadians, Ontarians can take to try to prevent this surge. My main message was, please, we have a narrow window to get immunized for influenza. The next 2 weeks are really critical. If we as citizens are going to blunt the effect of these viruses on our communities, you can get your COVID booster, which is bivalent, which has great protection against the circulating COVID strains. The influenza vaccine is available to all Ontarians. Please come forward and get protected as soon as you can. That's our key message, as well as stay at home if you're sick. As good hand hygiene, wear a mask as you recover. And if you're at risk to these viruses, it really is prudent to wear a mask now. We all have a role to play to try to decrease the burden on our hospital sector. We do see and predict that by first or second week of December, influenza will be peaking in Ontario. It's starting to rise across Canada, and that risk is there. But there are interventions that individuals can take to try to blunt the effect of these viruses on our personal health, as well as the health sector.
Okay, you said a lot. I want to follow up. What can you tell us about this year's flu strain?
So good news is that we know this virus. It's a influenza A H3N2. It appears to have a very good match for the current vaccine. So we anticipate the vaccine being able to decrease your risk of being hospitalized for this virus. And we know those that get hospitalized are those with any underlying illness, those that are older members of our community. And in Ontario, at least, there's plenty of openings to get vaccinated. I booked mine on the 1st of November. I was able to book the same day. Pharmacies are providing it, primary care providers, as well as public health. So we have vaccine, we have vaccinators. We need our citizens to step up and get protected as quickly as we can.
Dr. Moore, you refer to this flu season as a triple threat. How did we find ourselves in this situation where we're looking at so many viruses all at once?
Yeah, I'm so sorry, Marcia. These are the viruses that typically circulate this time of year. So RSV is well known to us. It's a common cold in children. By 3 years of age, almost 100% of children have had this virus. But the very young often get quite congested and sometimes need oxygen, sometimes need assistance in breathing if they get infected. But that's a very small percentage. We're building the capacity to ensure we can care for all children if necessary, if that surge continues. The other main surge in children get influenza as well and can get the vaccine in Ontario to get prevention against influenza. So we have strategies for both of those, but the health system normally copes with RSV and influenza, but the combination of RSV, influenza, and COVID could really stretch our system. So hence the reason I really need all Ontarians and Canadians to take advantage of the immunization strategies we have in place, both for influenza and for COVID, as soon as they can.
What's going on with COVID cases? We know that they're going up. Is it because people are not getting the booster shots?
Well, happily, 1.5 million Ontarians have come forward, and 1/3 of people over 70 years of age have gotten the September forward booster in Ontario. Absolutely need more to come forward. It's open to all Ontarians 12 and up to get their booster with this bivalent vaccine, which will provide additional protection against COVID through the winter months. So that's a great strategy to encourage all members of our communities to embrace, as well as I've said, the influenza vaccine, which should have good protection this year to prevent an impact on our health system.
Can you get both shots at the same time?
Great question. Thank you so much. Absolutely encouraged. Just for the efficiency of each individual, you can get those vaccines simultaneously, different arms, different syringes, and many clinics are prepared to offer both influenza and COVID booster at the same time. Thank you for that.
Okay, so let me circle back with my first question to wrap up. At what point will you decide whether masking or other public health recommendations are needed, Dr. Moore?
Well, I just want to reemphasize, if you're at risk to these viruses, RSV, influenza, and COVID, please, you should be masking as you go indoors. We really need to protect your health and the health of our community and the health of our health sector right now over the coming 6 to 8 weeks. If the health system is telling us they're getting inundated and we're losing capacity to care, we will message that transparently in an accountable way to all citizens to mask up. I absolutely want to avoid a mandate, but keep Ontarians informed of the risk as we progress through this winter.
Dr. Moore, thank you so much. Dr. Kieran Moore is Ontario's Chief Medical Officer of Health.